Hello, I'm Dr. Inman. Lots of you know me. Essentially, I'm the laser guy. Essentially, this is a short video on upregulation and the use of the red-violet laser. If you've noticed that I am rather skinny looking, essentially I'm undergoing lymphogranulomatous lymphoma therapy, essentially, and I'm on my second or third tranche of chemotherapy, which has caused me to lose about 70 pounds. Your question is going to be, well, why don't you use your red-violet laser? I am, and rather extensively. It has been elemental in tissue lysis, and of course we'll talk a little bit more about that later. However, what I want you to be aware of is that the reason for using the red-violet laser, which we have now, essentially is for upregulation purposes. The red-violet laser is this guy. It'll turn on this way. Boop, 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 boop. Hopefully it's cooperating right now. And we'll go ahead then, and it's set right now for lymphogranulomatous lymphoma, and so we'll cause it to come up, and we will do lymphogranulomatous lymphoma, and put glasses on. And now, if you'll notice, it's basically lasing red, probably blindingly so. Lasers red, and now it turns to violet. It basically switches between red and violet laser. And the purpose of this particular video is to explain to you why that is in fact the situation. The red-violet laser, essentially, and I'll continue to laser myself doing this, the red-violet laser is designed to actually get there with the violet laser, which has exactly 2.0 electron volts per photon. The red laser, essentially, has 1.5 electron volts per photon, lesser amount, essentially. The infrared laser only has 1.0 electron volts per photon, and the body requires, it requires 1.45 electron volts per photon to actually elevate the electron from the pre-state to the energy of activation to cause the DNA transcriptase to function at the cellular level of the mitochondrial DNA, allowing it to split open. DNA transferase basically is proliferating messenger RNA that runs out into the cytoplasm and grabs onto a ribosome and starts doing whatever it's supposed to do. For instance, like a fibroblast would do that, and it would basically communicate at 20.5 frequencies, 20.5 cycles per second, the section of the mitochondrial DNA that codes for fibrin production or collagen production. Messenger RNA runs out there, grabs onto a ribosome. The ribosome basically grabs onto a proline, hydroxyproline, puts them together into a collagen bundle. And then that bundle is spat into the system, essentially, and auto-regulates, essentially, to a bone or a collagen or a tendon or whatever. Okay, so we use that a lot, and that's fine. So that's what happens. But the important thing is that and we've used this with the red laser. A lot of you have the red laser, and this particular instrument has been worthwhile, and we've used it an awful lot. Whoops. And so we've used this particular laser for a goodly amount of time. And if you've got one of these, you've got one of the best lasers out there. It has actually been somewhat replaced by this particular device because it's red-violet. Now, think of the disease processes as a stack of pancakes, if you would. And you want the pancake on the bottom. They're all different pancakes, but you want the pancake on the bottom. To get to that pancake, you have to eat the pancake on top, which you don't necessarily want. You just want the one on the bottom. It'd be nice if we could basically take the bottom pancake and put it on top, and that's what the violet laser does. The violet laser gets there with more electron volts per photon. And if you can recall your physics, essentially, electron volts is electromotive force. It's not the amount of electrons that are driven there, like current. It's the amount of force each electron basically does. And so what it does is it grabs the system, like by the collar, and says, you're going to look at this first. And when we have a condition, a lot of conditions, 40% of all the conditions we treat are held in place by a primary. So it basically goes in there and drags the primary to the top and allows us to be able to handle that. And it acts like the primary domino in a chain of dominoes. And so when we knock that down, all the rest of them knock down. For instance, people come to you with a chronic condition like impetigo or a skin condition, essentially. It's being held in place by the liver, even though the liver enzyme tests look normal. And we would not treat the liver. However, once we treat the skin condition with either the red laser or even with this laser, essentially, without using the red-violet combination, the animal gets better, the person gets better, essentially, however it comes back. And so there's obviously a condition that's holding it in place. And in the case of this example, it's the liver. And so what we have is we have programmed into this instrument, we have programmed into this instrument 2,000 different protocols, which actually involve the primary, handling the primary along with the secondary and other tertiary levels of pancake, if we will, so we can take care of the clinical condition. So people come to you with a clinical condition, and about 40% of them are held in place by a primary condition that would more effectively be treated by the red-violet laser. The red-violet laser is the sixth generation of lasers essentially out there. It is the state-of-the-art for laser in the world, and we're so incredibly proud that we're able to utilize this particular chassis essentially as a means to deliver this particular set of frequencies in this treatment technology. It is revolutionary. It's easy for me to say that because I did not create the laser, but we program it and utilize the laser to do what it is that we want to do. As you can see, it's the same size as the previous lasers because it comes in the same container. The previous container was infrared and red laser. That's the LZ30Z, the red one that some of you have. This is an LZ30-Z2, but it's LZ30-Z red-violet laser, and so they replaced the infrared laser light with the violet laser light, essentially diode, and so it has the violet diode in it instead of the infrared, which we don't use. We never use the infrared in the first place. So it's a red violet laser essentially, and it is the one that we have grown to use and utilize it primarily. For those of you who have this laser, you're going to hold on to this because it's a classic workhorse essentially, and you'll use it and use it and use it. These lasers last anywhere from 7 to 10 years before you have to even replace a battery, and they have no real moving parts outside of a fan in them, so they're probably pretty much indestructible. I would mention to you that this condition or this device essentially is available only through me with the protocols. You do not want this laser essentially from any other source, because without the protocols, essentially it's a really expensive laser pointer. The original red laser essentially was about $7,600 with about 1,800 protocols that we have used, and it's still available. However, this device, the red-violet laser, is not only available with those protocols, but updated. All those protocols have been updated for the red-violet laser, essentially, and all of the primary frequencies that hold things in place have also been programmed. So when we click on something like lymphogranulomatous lymphoma, essentially like I'm using on myself, we're basically dealing with the immune system, obviously, and also the pineal gland, which are primary for this particular cancer, and it gives us a significant response. We started using this instrument on my lymphoma, essentially, before we started chemotherapy, and the tissue lysis that was created by this instrument took the tumor from being this big as essentially a football, down to about the size of a banana in about 4 or 5 days. However, unfortunately, that material had to go someplace, and in so going someplace, it had to be picked up by my body, and I went uremic, and it had to be IVs essentially because it worked too well. We do not use the red-violet laser or the lasers as a primary treatment technology for cancer. Okay, it's important that you understand that we treat the effects of chemotherapy and the effects of the cancer with the laser, not as a primary therapy. Maybe in the future we'll be able to utilize that as a primary therapy for cancer, but right now what we use it for is we use it for treating the symptomology and signs associated with cancer and cancer chemotherapy. Okay. Getting back to what we were talking about is this a red laser, which is $7,600 with 1,800 protocols. The Avant people could have charged an extra $10,000 for the red-violet laser. It cost them an extra $600 or extra $400 for the diode, and they've increased the cost of the primary laser to the red-violet laser by about $600. So this one is $8,300, and you call me up and we arrange for you to get one. Right now, it takes you at least a month before one arrives in the mail, essentially. So contact me at area code 208-640-3430. 208-640-3430. And in a personal note, I'm feeling a hell of a lot better. It looks like my survival rate for this lymphoma, which is a non-Hodgkin's lymphoma grade 4, has gone from being dicey up to well over 95%. So I'm tickled with that, although I'd like to gain weight. I'm certainly hungry all the time. And I wanted to make sure you had some data on the upregulation ability of this particular laser, because it is a 6th generation laser, and it is the world standard of laser therapy. Excuse me. So when we use this on our beloved doggies, we try to use this on our doggies, then we don't have to use any more than laser light, just like this. People say, well, you have to be right on the tissue. No, we can be this far away. We can do the whole dog's back at one time, or we can do the whole body at one time too. So this essentially is how it is we utilize this laser. Worth its weight in gold. Things should pay for itself in a clinical practice in about a week. And after that, it's just gravy. 208-640-3430, and ask me whatever questions. I would prefer for you to talk to you on the phone with a live telephone call. I'm Pacific Standard Time. And at that particular telephone number, we'll give you more information for this particular instrument. Of course, money back guarantee, although no one's ever sent one back. Thank you for your patience and your time, and have a super day. And if you think about me, give me good wishes, essentially. It'd be nice to have that support as I try to get rid of this rotten cancer.